Good morning, I'm Dr. Greg Smith. I'm one of the orthopedic surgeons at the Jacksonville Orthopaedic Institute. So probably the most common injury that I see or problem is rotator cuff difficulties, which really can affect anybody from a high schooler, a quarterback, a pitcher, all the way up to more of a senior citizen who's playing golf or tennis. Most commonly, they're coming in complaining of pain, which then is leading to some weakness. In a younger person, it's typically going to give them more performance issues. You know, they can't create quite the velocity with a pitch. Their accuracy is off when they're trying to throw the ball, that kind of thing. With an older person, it's more pain, catching in their shoulder. They might feel some popping and grinding at times, limitation of motion, starting to get some stiffness, or then it really starts to give them issues with sleep. That's usually the thing, like the last straw is the sleep, and then finally they're like, yeah, I can't take it anymore, and at that point they come in and see me. Fortunately, the majority of these injuries that we see are very treatable through non-surgical interventions, through physical therapy, medication, strengthening, sometimes directing people into better mechanics, body mechanics, either through our athletic trainers or our physical therapists. Occasionally these things need injection. I tend to tell people probably 80% of what we see we can get better without surgical intervention. And then certainly there are some that need that surgical treatment. I always encourage people, it's funny, people a lot of times will say, well, I was scared to come in and see you as a surgeon because I was afraid I needed surgery. And I'm like, yeah, the majority of this, we are able to get better with people without the need for surgical intervention. But if they need it, again, I'm an orthopedic surgeon, we can take care of that as well. So, I just say, if you have shoulder pain, come see us. There's a lot we can do for you to get you better.